I ask unanimous consent that my full statement be included in the record. Unfortunately, I have a group of Nordic parliamentarians who I'm hosting in a few minutes, so let me first say I join my Senate Finance colleagues in this effort because I still think the legislative process matters, especially when you're dealing with matters of life and death, like health care. In 2009 and 2010, we had a painstakingly open, deliberative process while drafting our health care reform bill. In the Senate Finance Committee alone, we held 53 hearings, roundtables, meetings, consulting with patients, advocates, doctors, industry leaders. And only after months of bipartisan negotiations and marathon markups did we bring the health care bill to the floor. And when we did, we spent 25 days debating it in full view of the American people. That's how we passed a law that protected Americans with pre-existing conditions. That is how we stopped health insurance companies from dropping consumers the moment they got sick. That's how we passed a law that delivered coverage to 9 out of 10 Americans for the first time in history, because when you have an open, deliberative, bipartisan process, you can deliver real progress to millions of Americans. But when you have a backroom partisan process, you get an ugly partisan bill. And that's what we have with the Senate Republican health care bill. It's an ugly bill in terms of what it does to people. It's born of an ugly process and has ugly consequences for the American people. And just last night, as we've all heard, the CBO, the Congressional Budget Office, the nonpartisan scoring division for all of us, Republicans and Democrats alike, said 22 million people will lose their health insurance, 15 million next year if the law were passed. And mind you, this is a plan that was supposed to be better than the House Republican version. Well, that bill was mean. This bill is downright nasty. Because it takes health care away from those who most need it, only to give tax cuts to the Warren Buffetts and the Donald Trumps of the world, who, fortunately for them, don't need it. Now, it's amazing to me that for years I've heard my Republican colleagues rail against the Affordable Care Act, or as they call it, Obamacare, pledge to repeal it, replace it with something better. They had 7 years to come together and decide what that would be. And then only on a plan that was put out late last week, we see the consequences of something that was rushed together by 13 men, no women, and nobody creating the diversity of America as it relates to their health care. That's just fundamentally wrong. And I'm not surprised that many of my Republican colleagues revolted against it, at least at this point. The question is whether they will continue to demand of their party and of all of us the type of health care that we want to see for each American. Because under the plan as it was proposed, Americans pay higher premiums, higher out-of-pocket costs, higher deductibles, all for less comprehensive coverage. Pay more for less. And it rolls back key consumer safeguards. There is a difference between a guarantee. When we hear the word entitlement, we're really talking about a guarantee against lifetime limits. You have a serious disease, you come up to that cap in your insurance, you still have the disease, you still have cancer, you're still treating it, you're still fighting it, you're trying to save your life, but you don't have any more money because there's no more insurance coverage. We eliminated that under the law. There's no guarantee of continuing that safety under the Republican bill. There's no guarantee that when you send it to states and give them waivers and the way in which they treat those waivers, that truly you have a guarantee against pre-existing conditions not being a prohibition of getting health care. And then finally, if you're middle class and middle age, this bill gives you nothing. And if you're older American, it costs you enormously. Let me make my final point about Medicaid. Look, I'm tired of hearing about Medicaid being only about the poor, as if the poor don't deserve health insurance. They certainly do. But Medicaid is about a lot more than the poor. In my home state of New Jersey, 60% of Medicaid recipients are either seniors or those who are disabled. They didn't choose to be disabled in their life. They either were born with or developed a disability. They deserve the full potential of their God-given potential as anybody else does. Medicaid provides them the health care for them to be a successful part of our society. Medicaid provides seniors with a dignity in the twilight of their lives. Medicaid provides for pregnant mothers who may not have insurance elsewhere. Medicaid takes care of special education children in our schools. And yes, Medicaid takes care of the poor. And Medicaid expansion helped those who go to work in some of the toughest jobs in my state and in our country have the dignity of having health care and being able to stay healthy so they can work. We want them to work. And yet we take away the very health care that is the essence of keeping them healthy so they can work. That's not the America I know. It's not the health care that was promised. And it's not what we can do better, and we can do better together. What we need to do is get over the mantra of just let's repeal the Affordable Care Act instead of improve it. If we want to improve it and improve the health care of Americans, you're going to find a lot of Democrats, myself included, ready to do that. And with that, I yield the floor.
Mr. President.
Senator from Oregon.
Mr. President.